Hey guys, welcome to Pancreas Pals. Emily here.
And Miriam.
She's back, and so am I.
Back.
So,
Woo-hoo.
Thanks for bearing with us with our constant hiatuses.
We're in a season of flux.
I said that once, and it's Miriam's favorite word.
It's really stuck for me.
Here for you.
It's been a lot of flux.
We're back. Not to start things off on a sad note, but I do want to thank everyone who reached out to me about my grandma passing. So love all the pals, and that is a big reason why we had a little bit of a hiatus, because I got to go back and celebrate her life in Jacksonville. So it's been a couple of weeks, but we're here, and we are actually going to take a hard right and talk about something that has nothing to do with any of that, which is for all of our people with uteruses that are listening. We are going to focus on periods and diabetes.
Yeah. And hormones and diabetes and birth control and all of those things, which is something I think we've been talking about for a long time. I'm like, we should totally have a podcast episode about that. But never felt like we were quite qualified to. And on that note, we are not health professionals, which I know we tell you guys all the time. So this is not medical advice by any means. This is just our personal experiences, because we realize the fact that we do have uteruses, uteri, whatever the plural is for that. We're qualified in that sense, and that we have personal experience of having periods and also having diabetes. So take this all with a grain of salt, of course, but this is kind of things we've experienced, we've noticed, and kind of what we do to combat hormones.
Hormones. What a loaded word that has like so many different diabetes things. You know, you've got your hormones associated with diabetes and, insulin and all those things. And then for us, people with uteruses, so many hormones that goes with your period. So, I'm just rambling at this point already. So send help. But Miriam, I'd like to point out, has never had a period without diabetes.
That's correct.
She has had diabetes for every time, I'm guessing, sorry to call you out.
25 and a half. I think I just had my half birthday. my half anniversary. So 25 and a half years.
And I had, let me see. When did I first get my period? Just going to share this with all of you. I think I was 11 or 12. I became a woman. I hate myself. Ew. My mom's probably listening and cringing and laughing at the same time. But yeah, so I was diagnosed about 7 years ago. So I've had probably equal amount of periods without diabetes as with diabetes at this point. Not good at math, but I think you get the drift there. And I have to say, when I was first diagnosed, I did not even think about what that would mean as a woman, as someone who gets her period, what my blood sugar levels would be impacted by that. And I think that it's something that doctors have spoken to me about, but unless you actually get your period, it's not something you fully understand, because buckle up, people. It's a wild time. It is the wild, wild west of anarchy with blood sugars and periods. So we're hoping that our years of experience, and obviously we are not OBGYNs, we're not gynecologists, we are not endocrinologists, but our years of combined experience could be helpful, because let's be real, a lot of diabetes is crowdsourcing information. And
absolutely.
We're here to help. So I kind of just, not to put Miriam on the spot, that's my MO. I'm going to get that on a shirt for you, Miriam. But do you remember what it was like? Like, were you aware that when you were however young getting your period, since you'd already had diabetes for a minute at that point, were you aware of the changes in your blood sugar and your overall diabetes at that point?
Not at
like
all.
Anticipating
and honestly, you also have to put this into context. I was like a teenager, a bratty teenager.
We all were, Miriam. It's okay.
CGMs did not exist. I think I stand corrected. I think the first CGM, I know my pediatric endocrinologist, they had one that I could wear for like 3 days. It didn't give you any data. You would like wear it for 3 days. You'd go back to they'd put it on you. You'd go back to the office and they'd interpret the data like from there. I think that must have been like I think it was the first generation Dexcom actually.
That's wild.
And that I was already in high school.
Right.
So like CGMs did not exist, so we weren't paying as close attention to blood sugars. And I was like going through a bit of not a rebellious phase with diabetes, but it was that phase where my parents were stepping back the management. I was sort of stepping up. So it's this weird in between where, like, long story short, I was not paying that intense attention to my blood sugars and what was happening. So, like, within the context of that, I was not aware of, how my blood sugars were changing with periods. And to be honest, it wasn't even something that was really brought up to me by my doctors. In hindsight, like, I feel like they probably should have mentioned that, but it was not something that was brought up to me as like, oh, be aware, you might experience, this happening to your blood sugars right before your period. You might experience this after your period. So I wasn't really looking for it. And my priority at that point was like, all right, don't get too low and like, don't end up in the hospital. Like I was very much in like
another
survival.
thing we need on a shirt.
Exactly. Which is really I think the high school and college like parameters I lived by, because that was my priority. It was just being normal and fitting in and like not getting so severe that something dramatic happened, of course. But so yes, this was a long, convoluted way to say no. I was not aware of these major changes. The only time I was like aware of something was, I remember my period, which is common for a lot of people when they first start their period, when they're like a preteen or a teenager. My periods were super irregular. I didn't always know when they were coming. Sometimes it was once a month, sometimes it was every 6 weeks, sometimes it was every 8 weeks, like, and that kind of happens when you're, first becoming a woman. So it wasn't that out of the blue, but I remember I ended up going on the birth control pill pretty early in high school because my doctor said it will be helpful for you diabetes-wise to be able to know when your period's coming, to be more predictable, to kind of know what to expect. So with the pill, I had, took it religiously, so I had it every single 28 days. Like, I knew exactly when it was coming. So I did that to regulate my blood sugar, to regulate my period, which in turn I think helped my doctors probably adjust my basals to regulate, my blood sugars. But that was the only time it really ever came up.
That's so wild. Again, I had
a
very
West.
Different experience. One of the reasons why how do I put this / how do I even remember this? I'm not sure if I'm remembering this accurately, so take this with a grain of salt, but it was my freshman year of college, so before I was diagnosed with diabetes, but I went on birth control because I was like, I'm going to be a responsible adult. I'm in college, blah, blah, blah. I get on birth control, and then that summer, like 4 or 5 months later, is when I had a new GP who checked my blood sugar without fasting, like telling me to fast, and that's when, my year-long journey into my proper diagnosis began. And when they checked my blood sugar, it was obviously super elevated, and they were like, okay, well, what's changed? Maybe this, you're too old for type 1. What's changed? And one of the things that had changed was that I'd gone on birth control, and they were like, okay, let's take you off and see if that's what's affecting your blood sugar. And it did actually decrease my A1C a few points, not like full points, but like I went from like a 6.4 to a 6.1 A1C.
And this was before you were like taking insulin even.
This is way before this was over a year before my proper diagnosis. Yeah. So birth control is kind of one of the things that I had attributed, which it's very well known that birth control can affect blood sugar numbers. It can increase or, whatever, especially because my period had always been super regular growing up. I always had quite awful periods. I'm not talking about like endometriosis, but like enough to where I like had to sit out a few PE classes during my time of the month. But yeah, so it's so interesting that your doctor like kind of recommended that to help you gain better insight or control, if you will, of when you'd be getting yours, whereas mine, it ended up really actually pushing me further, allegedly. Looking back, this is like what I was told. Again, who knows? Now I know that I had type 1. There was no way that was going to change, and birth control wouldn't drive someone into diabetes. But it can help with, or it can cause insulin resistance when your hormones are fluctuating like that. So it's very interesting. Again, we had very opposite interactions with the pill, but it kind of brings me to what I wanted to talk about is other forms of birth control and how, things like an IUD can make a big difference without having added hormones like flooding in your bloodstream type of thing and keeping it localized to like your uterus. And really an IUD for me has been the best move because it doesn't affect my blood sugar. I still get all my fluctuations and crazy numbers from my time of the month, my normal, monthly cycle, but this time I'm not like adding hormones, which has made a big difference in my management and still feeling covered. In that regard. So, and I do know a lot of diabetic people with uteruses that love their IUDs, and there are also plenty of people that use the pill. It kind of just like diabetes management, it's not one size fits all for birth control.
Exactly. And I think, I agree. Some people react very differently to certain hormones. Like I've been on throughout my adult life or since I started in high school, really, couple different pills, which in theory are like all do the same thing, but just emotionally I've responded very differently to them. So even minor shifts in those hormones can really impact you. Blood sugar wise, I never really had an issue with the pill. I think once I kind of
also already on supplemental insulin. So
exactly. That's what I was going to say. I think once you're already on insulin, it's just about like adjusting levels or adjusting basals if you need to. So I never had a major blood sugar issues with the pill. But that being said, I also loved IUDs. I think it's just nice to not have to take a pill, and it's differently than diabetes. Where you're thinking about it 24/7, it's nice to have this other medical thing that like get it once, whichever one you're on, you get it once every 3 years, once every 5 years, once every 10 years, depending on which one you have, to like set it and forget it. Like you do not have to think about it. It's taking care of things on its own. And, a lot of the IUDs still do have hormones, but the magic of them is that it's localized. So the hormones are only really reaching your uterus and your ovaries or whatever, that part of your body. It's not necessarily hitting your bloodstream, so it's not going to have the same impact that the pills have.
But has the same outcome in terms of preventing unwanted pregnancy.
Exactly.
Trying to figure out how to phrase it. But
exactly. But it's not as effective of like regulating your period. So if a lot of people do the pill to help regulate the period, like the IUD is not going to be as effective doing that necessarily.
And it can honestly, most of the time, in most cases, depending on the IUD you have, it can make your period kind of go away. But something that I found that's super interesting is that over time it has made my period go away, but I still see those blood sugar fluctuations that I normally would around my time of the month. So just because I'm not having like a physical period,
bleeding, the hormones are still doing their thing. The hormones
are still doing their thing. So
that's interesting.
It's really interesting. And again, I wouldn't have known this had I not had my CGM and like been a super analytical human. That's just like, here we go again. So, okay, now that we've talked a little bit about birth control, plural, birth control. I think one of the things I really wish I'd known before, really not before anything, but from the get-go, is that there will be blood sugar fluctuations with your period and that every person is different. I had so many doctors telling me, oh, you're only going to experience insulin resistance during your period, blah, blah, blah. And it's like, for me, it's the opposite. I am super insulin sensitive on my period. And even a few days leading up to it, whereas the full week before I'm insulin resistant, or sometimes I'm not insulin resistant at all. Sometimes I'm just super sensitive. I was never really told that was normal. And I literally had not doctors, but like nurses being like, Oh, I've never seen that. I don't, usually it's just insulin resistance. And it just always made me feel like a little bit worse.
Yeah.
So I'm here to tell you, no
feel
matter.
like crazy. Yeah.
Yeah. It's like, it's not gaslighting, but it's a little bit like, okay, just because you haven't seen that doesn't mean that it's not a possibility. And I think it really took a few years for me to finally to get a nurse being like, oh wait, yeah, no, that's completely normal. You know, don't worry about it. Just set a temp basal or just undercover some of your carbs during this time. Like, I will go through probably like I've gone through periods where literally periods where it's double the amount of insulin that I've usually used in that week versus half. It really just depends. And I think that that's like important to note. I don't know. I feel like this, not to go on my, I'm going to go on a tangent, buckle up everyone. I just feel like as women or as someone with a uterus, if you don't identify as a woman, we're constantly systematically failed in healthcare in so many different situations and made to feel like something's not valid or that we're not being taken seriously. Case in point, so many of us who've taken such a long time to get a proper diagnosis for our chronic illnesses. But especially when it comes to your period, having a male doctor kind of tell you something's not, you know, they're like, oh, interesting, but they're not, you know, that maybe it's not valid or that they're not sure if that's accurate.
Yeah.
Don't be afraid to speak up and say something. Or, you know, I'm not saying you have to have a person with a uterus be your doctor. Like, I do have a woman now as my endocrinologist, but to me, it does make a big difference because it's just at the end of the day, they get their periods too, or they at least know what it's like, and or are more open to at least sympathizing with it. I get a little salty when I hear men with diabetes comparing how easy, and I'm literally quoting someone, how easy it is to manage blood sugar numbers.
I know. I was thinking about this at the beginning of this episode. Like, we, as you guys know, we don't like to say like, oh, we have it worse or they have it better.
Right.
But in this instance, I think type 1 diabetic men, this is one piece where this is one factor they don't have to think about, really.
They just don't. At the end of the day.
They just don't. Like, they don't have to worry about this every month of, like, having to change their basals when this is happening. Like, this piece is easier for them. For sure. And it's kind of just one of those things that unfortunately is another cross for us to bear. Like, no one's no one's gonna you don't have to get pregnant and have a kid with diabetes if you don't want to. You don't have to there's options out there for everyone, especially if and everyone has their own unique relationship with their body's hormones and all these different things. But I can't tell you how many times I've just felt so salty having a conversation with a pal, really not like a Pankers pal, but like at a JDRF event or something, and hearing a guy be like, well, why, obviously we're big believers in not comparing ourselves to other people, and I don't believe in discussing your A1C unless it's like an actual therapeutic course of trying to figure out what's going on with your body. I just don't believe in A1Cs in general, but that's a whole other thing. Time and range for life, guys. But it just really irks me for anyone to say that a chronic illness is manageable when you're not dealing with this whole other elephant in the room that is, that can really make or break an entire, let's be real, like 2 weeks of the month, half of your month, aka like half of your year, is either leading up to your period or during your period. And when you take those numbers and put them in perspective, like that like hurts my brain.
It's unfortunate, but like it's gonna play a big part in your ultimate management.
For sure.
For better or for worse, like people with uteruses, you usually get to bring babies into the world if you choose to do that. Like, there are, we're not saying it's bad to be a woman and like boo-hoo or whatever, but it is a struggle that it's another thing to think about.
Absolutely.
So I just, I like I stress myself out even thinking about past conversations I've had with dudes who are like.
I actually had a similar conversation with someone at a JDRF event, Emily. So we can discuss after if it was the same person. I have like an inkling that it was, but it was a similar thing in that like I was
this
talking.
Was years ago, by the way.
This was years ago, like probably 5+ years ago, if that. And I was talking with a friend, being like, oh, like. Yeah, she was saying, oh, I would love to work, like volunteer with like newly diagnosed type 1 diabetic kiddos or something to help with like the psychosocial aspect of it. And I was like, yeah, I would love to be a therapist for like type 1 diabetics eventually, which like I now am, which is wonderful. But I remember like this guy was over like hearing us list like part of the conversation. He's like, well, why does everything have to be like diabetes themed? Like it's just like a disease you're managing. Like it doesn't have to impact every other thing of your life. And it was just one of those realizations like, no, he's right. It doesn't have to. But I think we also need to acknowledge that it sometimes does. Yeah. It often does, whether you want it to or not. And so I think pretending it doesn't actually makes it worse instead of just accepting like, oh, it actually does impact all these other pieces of life. So like I had my own little feelings about that interaction, and I like have a very strong feeling this was the same person.
99% of it was the same person. But he's great. We just all have different perspectives, and I think that's I don't want anyone who doesn't have a uterus to listen to this episode and think, oh, they hate men or they're minimizing our plight with diabetes. I think that if anything, what we're trying to have come across is that diabetes is hard no matter what. Yes. Every human body will find diabetes, and animals I'm sure too, will find diabetes hard. It's just the added stressor of an event that takes place. And, if you're a healthy whatever, you want to take place if you're not trying to be with child. Like you want this to take place every month, but it's a blessing and a curse. And I think that it's important to recognize that and just also give yourself some grace during that period, so to speak. Pardon my dad joke there, but it's moral of the biggest thing I want everyone to take away from this episode is that if you get a period, give yourself some grace. Yeah. It is a little bit of a cluster. Censorship here, but clusterfuck, because it's
not always the most predictable.
You can plan for it as much as you can, but that's all you can do.
Yes. But I was going to say, if everyone can like bear with me for this little baby science lesson, that I learned a lot about periods. And again, most of this was like self-taught because this isn't really something doctors were teaching me. But I tried to learn a lot about my periods to kind of figure out the pattern of like, why do I feel like sometimes I'm resistant, sometimes I'm super insulin sensitive. I can't really figure it out. And so I learned a lot about just being female, having a uterus, I should say, and having periods. And so bear with me, but I'm going to share this knowledge that I've picked up with you guys, and I think you might find it interesting too. So basically, let's pretend you have a perfect, textbook cycle of 28 days. That's an average period is 28 days long. That's your cycle. And so there's two main players in your period. It's estrogen and progesterone. Those are the two big hormones. And they're kind of opposite. So think of it like when estrogen is high, progesterone's low, and vice versa. And so when you're on your period, estrogen is high. And estrogen as a hormone makes you very insulin sensitive. And so estrogen is high during your period, which is why when you finally get your period, your blood sugar tends to be on the lower end. You might notice more lows. You might just not need as big of boluses. That's what tends to happen. And progesterone is super low at that point. As you go along in your cycle and your period ends, those two hormones are sort of like they cross over eventually. But estrogen starts to go down a little bit, so you're not as sensitive, whatever. Halfway through your cycle, you ovulate. That's when your ovaries release an egg and, starting the process. And then once you ovulate, you kind of hit that halfway point, boom, your progesterone starts going up. And so when progesterone goes up, you get super insulin resistant. That's what progesterone does to your blood sugar. It just makes you resistant to insulin.
Which can sometimes be in steroids, correct?
Maybe
not.
I
if
think
Steven's listening, if Dr. Schulberg's listening to this, he's probably like, nah, Emily, buckle up, take a back seat.
They
okay,
do have like progesterone supplements and stuff, but I don't know if it's a steroid necessarily. I know what you're thinking of, though. It does sound familiar to like a steroid name. As progesterone increases, like after you ovulate, which means you're either heading towards pregnancy after you ovulate, or you're heading towards your period. Hopefully, if you're not trying to have a baby, you're heading towards your period. And so progesterone goes up and up and up and up until you hit your period, and then it goes down again, and estrogen goes up. I'm like making all these hand motions, so I'm hoping listening to this it makes sense. Can hear that. But so imagine progesterone going up. So this is the hormone that makes you super insulin resistant. It's going up until you have your period. So that's why like when you're PMSy, really, that's all progesterone. When progesterone's making you feel PMSy, progesterone is raising your insulin resistance. So that's why your blood sugars are more likely to be more stubborn, to not respond to insulin as effectively. And until you get your period, basically, and then boom, sensitivity comes back. Does that make sense?
It definitely makes sense. I really wish that I had known this earlier. So thank you for the science lesson, Miriam. And again, like this isn't necessarily the textbook case for everyone, but this is literally just a little lesson on what these hormones do.
Exactly.
And it's not both are hormones that are involved in the period ovulation process.
Exactly. So and if you're having normally functioning periods, those are the two main hormone players of your period. And so typically that is what they do to your blood sugar. If you're not noticing that, that's okay too.
That doesn't mean there's anything wrong with your period. Yeah.
Again, some people just don't respond to hormones as strongly as other people. But that's typically what happens. And so I'd really urge people, I used to just like kind of keep track on my my calendar app of like, oh, period, I'll probably get it X amount of days later. But I'd really suggest for people to look into other like phone apps or like whatever systems you want to use, but like actual period apps that you can track. Like it'll tell you which part of your cycle you're in. Are you in like I think there's all these phases. I can't remember the order of them. One's like follicular phase, the ovulation phase, the luteal phase, whatever. There's all these names for them. But you'll be able to kind of pay attention of like, oh, in this phase, my progesterone's increasing, so I'm more likely to be resistant. So just kind of keep keep an eye on it sort of thing.
Right. And we're not recommending that you you take this information and immediately go change all of your rates.
Oh my God.
Like obviously definitely consult your doctor, or this is more for like an observation and
exactly
like just a clinical aspect of it. Look at it.
To learn about your cycle. I think it's just it's very empowering. It's something that happens to us, and I think like so few of us actually we didn't sign up for it. Just like a lot of things in life, but something that happens to us, and I think so few people actually know much about it. You know what I mean? It's like,
I had no clue. And think about all the people that are listening to this that are post-menopause that have had diabetes for their 40 years, and they're like, oh my gosh, no one told me that. And it's like, it's unfortunate, and that's kind of where my pedestal comes in. Like we should be given these important pieces of the puzzle, because at the end of the day, they really does make up the map of diabetes for people with uteruses who experience their periods. So and I'm sure there's their own puzzle that comes with post-menopause and hormone fluctuations and that.
We're not, we haven't crossed that bridge yet.
Yeah, knock on wood, absolutely not. But as far as apps go, I know for tracking, I love what I used for years before the iPhone health app started helping track with that, which is great, and I fully recommend to use
I do like that
app. M Cycles is like monthly cycles is one of my favorites, and it's free, and it'll track it and send you alerts like before, like when you're I'm not trying to get pregnant, so I don't get ovulation alerts, but like days before your period, or if you have a missed period, it'll alert you, all these things. But there's tons of free apps out there, and just a lot of untapped resources that are just begging to be downloaded. So
there's a lot to be learned. Absolutely. Yes. And not to get and not to detract or like scare anyone by any means, but I think it's also, I noticed for a long time I was having, once I kind of shift to an IUD versus a pill, whatever, I was having very irregular periods. And it took a long time sort of talking about that with a couple different OBGYNs before I said, like, I feel like this is, based on what I'm Googling, my periods are like super irregular. I think this isn't right. And finally, they did blood work and I was diagnosed with PCOS, which is, like, I've learned is super common and
Very common.
especially with type 1 diabetics. I learned like 1 in 4 type 1 diabetic women or people with uteruses actually have PCOS, which is high.
PCOS is polycystic ovarian syndrome, by the way,
and
for
there's
anyone listening.
And it's a big spectrum of symptoms and things you can have with PCOS. I happen to have, like, none of the hallmark symptoms except for a regular period. But it's, you know, it's an easy, I mean, really what they suggest if you have it is the birth control pill, really. You know, just having those hormones kind of help you regulate it.
And it can really cause insulin resistance too, which is why it's important to get a proper diagnosis, because it can help map out your diabetes plan and management.
Exactly. And so I'm not saying, like, oh my God, you probably have PCOS, go find out. Like, I'm not saying that at all, but it was something, again, was not on my radar at all until I just started kind of paying attention to my period all of a sudden. And was like, hey, this seems kind of like, why aren't I
for yourself?
I really had to advocate for myself.
And that's so important and impressive, and it sucks that we have to be our biggest proponents, but at the end of the day, if there's anything to know about diabetes and really anything about being a human in 2021, you do have to advocate for yourself. There's so much going on in the world, and people are caring for a lot of patients these days, and like clinically, health-wise, whatever have you. And there's nothing wrong with getting a second opinion. There's nothing wrong with asking questions. And I urge all of our listeners who feel like they're not being heard to seek out healthcare and medical professionals that will listen to you, because there are people out there in your network that will. It might seem like there aren't. Again, if you live like in North Dakota, there might not be, but it really depends on your ability and access, and that's a much bigger issue that we can't solve with Pancreas Pals. But I hope that this has been insightful and helpful. If you guys want to drop us a line and let us know your tips with your time of the month,
or if you just want to vent with us.
We should start like
a vent line.
Or we can share our favorite chocolate snacks that we eat that don't spike our blood sugars during our time of the month, because your girl has gotten good at that Skinny Pop chocolate chip mixture. Let me tell you, that trust me, I got you.
It doesn't. Oh, you make it yourself?
Yeah, I make it myself.
I was like, does that exist? And I've never seen it start.
It doesn't, because honestly, the chocolate chips kind of negate the Skinny Pop, but like I'm here for it. Whatever.
I only ever get the white cheddar Skinny Pop, so I won't add chocolate chips to that one. But with the regular sea salt, I think that'd be great.
Sea salt one's really good, and I do like dark chocolate because, again, dark chocolate doesn't really spike my blood sugar,
and then it's an antioxidant, so you can feel good about it,
which is good. Yeah, which is good for your period and for every other time. Anywho, thank you guys so much for listening to our rambles and rants. We have a few more episodes left of the season, so stay tuned. If you like what you hear, please like and subscribe. But also, we love to hear from you guys, so please hit us up on Instagram at pancreas_pals, on Facebook at pancreaspalspp. Email pancreaspals123@gmail.com. We love hearing from you, and we're all in this together. Shout out to High School Musical, because that's the only thing I think about when I say that phrase. So I hope everyone has a great week. If it's your period this week, power to ya. This was perfect timing.
Solidarity.
If not, there's 3 more weeks for you to listen to this, to whatever it falls on.
3 to 6 weeks, yeah.
And for anyone who doesn't get their period that listen to this, we hope that you learned something, and that this will make you an even better ally for all the people with periods in your life. So thanks for listening, guys, and love you, Miriam.
Love you, Emily. Bye, pals.
Bye.